Hello, good evening. Yes, it's Dr. Tamara Beckford with URCaringdocs, and we're doing our weekly topic. So, it is the day after Thanksgiving, right? And I hope you all had a wonderful Thanksgiving. I hope you ate. I hope you ate a lot. And if you ate a lot and you started having some discomfort last night, then you might have what we're talking about today, which is acid reflux. That's right, our topic today is acid reflux. So before we go any further, I do want you to know that this is for information purposes only. We're not diagnosing anything today, right? We're just giving you information so you can make great medical decisions, right? So if you do like this information that we are presenting, do not hesitate to like, share with others. Don't keep all this great info for yourself. Subscribe to our page and definitely leave a comment. All right, leave a comment. Alrighty, so we are just going to bring this camera down a little bit more so we can see, and we are going to get started. Acid reflux. Things that we're going to talk about today is one, what are some of the causes? Like, what's the cause of acid reflux? Two, what are some of the symptoms of those who have acid reflux? Three, we'll talk about risk factors, and we'll talk about diagnosing and also some treatments. What are some of the things that people use to treat? But before we go any further, we always start with a little bit of anatomy, right? Anatomy. All right, so I have my drawing, so let's get started. So we're starting off with acid reflux. Let's go over some terms, right? Acid reflux is another term for acid reflux is, we'll cross this word, gastroesophageal reflux. So that's acid reflux. So acid reflux is also called gastroesophageal reflux. Now, if you are having these symptoms of acid reflux, which we'll discuss, more than like 2 times a week, and you're having a really severe version of it, then it moves from just gastroesophageal reflux to being gastroesophageal reflux disease. That's the infamous GERD that you hear, right? GERD. So what happens? You chew your food and you're having like really great Thanksgiving meal, and you have, you wash it down with some beverages, whether it be like something caffeinated or if it's a mild alcoholic beverage or anything. So you swallow your food, and when you're swallowing, the food's going down this tube, which is called the esophagus, right? So that's your esophagus, and then it goes into the stomach. So food goes down to the esophagus, into the stomach. So when you are having reflux, we have another drawing. We have a healthy stomach and then that with a reflux. Let's talk about what happens with the normal version first, and then we'll go over the reflux version. So your food goes down into the stomach here from your esophagus, and your food starts to get digested by acid and enzymes. It starts to chop the food up in order for you to get all the nutrients to be absorbed within the stomach, right? While that's going on, you have this muscular area, the lower portion of the esophagus, called the sphincter. So this sphincter closes in order for all of this activity to occur within the stomach. That's a normal, healthy stomach, right? If you are having gastroesophageal reflux, or if you suffer from gastroesophageal reflux disease, that sphincter here actually opens. And when it opens, when the activity is occurring within the stomach, which the acid and the enzymes are trying to help to digest the food, the sphincter is open, and so some of this acid goes back into the esophagus, and that's what's called reflux. So that's why we have gastroesophageal reflux or acid reflux. So this lower esophageal sphincter, which is a muscular area at the lower portion of the esophagus, is weakened and it doesn't close properly during the digestive portion, and there we go. Right? So gastroesophageal reflux. So what are some of the symptoms when you have the gastroesophageal reflux? Let's see. So our sphincter is opening and all of this is going upward. So you get what? The burning in that chest. You get that burning sensation, like, oh my goodness. Like maybe I shouldn't have eaten that extra spicy meal, or maybe I shouldn't have drank that coffee right before bed, right? Because you get that burning sensation. Another thing that you might get is a lot of belching. Like, oh, burp, 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 right? Belching, belching, belching. And then with that, you get that acid, taste at the back of the throat. Yeah, it is that acid that's coming upwards. In addition to that, some people might start getting a cough, right? Like, what is it? Well, if you have that acid that's coming up at the back of the throat and it's irritating the posterior or the back of the throat and it's just irritating it, then sometimes you start to cough, like, right? Because it's just a constant irritation. Some people also begin to have laryngitis because that same acid is coming. It's constantly just irritating the back of the throat. Now, none of this happens when you're sleeping, so it's not like you're sitting up and then, some people do have it, but when you go to sleep, that acid is just constantly going up and irritating the back of the throat. You wake up and you're just talking like this all the time because of that acid. So that can occur. In addition, you can also have some people start to get develop asthmatic symptoms like asthma, like wheezing and so on, because of that acid that's going on. Now, what are some of the things that increases your chance or your risk factors for reflux or reflective symptoms? One is weight. So if you are a little bit in the larger size, then that can, if you're having reflux, reducing your weight can help. Two, smoking. Yes, if you smoke, then that sphincter at the lower portion, then the smoking, it irritates and it causes that sphincter to open, and that increases your risk of reflux disease. Acidic meals, of course, the tomato sauce, chocolate, mint. I know those are things you would think like, oh, let me pop a mint or drink some, something or eat chocolates. If you are having reflux disease, then those are some of the foods that you can try to avoid to reduce that. In addition, if you are having fatty foods or fried foods or even alcohol increases those symptoms in you. So now, one of the bigger things that happens is that if you eat your meal, especially if your meal includes any of what we just mentioned, and you're lying down like right after that meal, woo, you're so full. Yes, I'm just going to take a rest and just lie down. So then you increase the chance of that reflux occurring, right? And then that burning in the throat and so on. So it is recommended that you don't just lie down right after a meal, right? You wait at least 2 to 3 hours before you lie flat. And if you do suffer from the reflux, you at least elevate your bed, sleep on a couple pillows so that you're not just allowing that reflux to just go right up into your back of your throat and have all those symptoms. So those are some quick tidbits. Now let's talk about if you do have reflux. How do you know? So a lot of it is symptomatic. So what we just mentioned, right? You have the burning in the throat, especially at nighttime after your meals. So you'll have that, but then we can do some diagnostic studies in order to try to help to determine. So one of it is called an endoscopy. So endoscopy, what is that? That's when the gastroenterologist, which is a stomach specialist, they will place a camera. This is while, of course, you are in a sleeping state. They'll sedate you and they'll place a camera down through the esophagus. They'll check the back of the throat, the esophagus, check the lining of the stomach and around the area. That's an upper endoscopy in order to determine if you are having these changes that can occur within the lining of the stomach, the lining of the esophagus because of this reflux. And they can do additional special testing to determine that, right? So that's an upper endoscopy. So if you do have these reflux or you have symptoms of reflux, there are some medications that can be used. You have some medications that are called like they have H2 blockers, which they basically reduce the amount of acid that your body makes. These don't really work immediately. They take a couple days, but you have to take them on a consistent basis, right? In order to do that. So some of those are medications you probably heard of. They end in the INE. They end in like their I think Tegament is one of them, cimetidine. You have Pepsid, which is formantidine. So anytime you end in dine, like INE, then you know that those are H2 blockers. And then you have proton pump inhibitors, which is another version. So that helps to actually heal the erosion that can occur because of the constant acid that goes up into the stomach. It can cause some erosion to the lower portion of the esophagus. And Protonix is another one of those omeprazoles or those PPIs, which are used to help. Now, you can use like antacids, like Tums. Those are for more immediate relief. If you're having mild symptoms, of course, you do that. Now, we would be remiss if we did not say that if you're having those mild symptoms and you're treating them at home every once in a while, that's fine. But if you're having persistent symptoms, 2 or more times a week, you're just having to use these over-the-counter medications, that's when you need to go see a specialist, right? So we have talked about acid reflux, right? We talked about what are some of the symptoms: the burning, the irritation of the throat, the sour taste, the cough that you can get, or even some asthmatic symptoms. We've talked about what are some of the foods that can increase the acid intakes, some things that we didn't even think about, like mint, chocolate, of course, we know, like tomato sauce, sauces that are high in acidity, alcohol, smoking. We've talked about what are some of the things that we can do if you're overweight, you can try to reduce. Another thing that's so important too is that if you're wearing tight clothes, yes, if you're wearing those tight clothes, we're going to have to reduce those tight clothes because it pushes on the stomach, pushes up on the abdomen, and causes an increase in the pressure. And then that sphincter, that's that lower area, and it starts to cause too much pressure on the sphincter, and that can increase and cause some reflux symptoms too. So you have to start wearing some loose fitting clothing, right? So we've also talked about changing some of the diet. And then we said that if you are taking medications too frequently, more than 2 times a week, then you need to see a specialist. The specialist can start you on higher doses of medications, and they can do a special testing called an upper endoscopy, which they put a camera in and look at the lining of the esophagus and the stomach and see if things improve and how to come up with a treatment plan to help you, right? So that is all about acid reflux and gastroesophageal reflux disease, which can occur if you are having persistent acid reflux. I'm Dr. Tamara Beckford with URCaringdocs. If you are having acid reflux symptoms, you can contact us with URCaringdocs. We can definitely help you. It's www.yourcaringdocs.com. You can book an appointment through the URCaringdocs Facebook page. It's right there. Just click. If an appointment is available, click it, and I will be happy to see you and to help take excellent care of you. So I'm Dr. Tamara Beckford with Your Caring Dogs. Like our page, subscribe, comment, and please do share. And I look forward to taking excellent care of you and your family. Have a great day. Thank you all for tuning in. All right. Bye-bye.